For 51 years, we've been doing missions in Central America, Africa, and all. There's always a need, and it's a growing need. The population in so many areas just doesn't have access. And it's in the osteopathic blood, so to speak, to reach out and try to provide care to those who just simply don't have it.
Getting an idea of what the culture's like, what the people are like, and what they have to do on a day-to-day basis to live. Being a part of this program with DOCARE and the other physicians, it's a great opportunity to see where we can help and where we can be of service. The impact that these people have on these communities that, for the most part, don't see opportunities to better their health or understand what they're living with.
DOCARE as an organization has really progressed for the past 50 years, but it wasn't until the AOA and DOCARE partnered that the infrastructure really started to build, and we as an organization really advanced. We've been aiming, and I've been working on a continuity clinic for the past 10 years. It's been my goal and the goal of any of us who do outreach missions ever since we started doing outreach missions, but it wasn't a possibility until the partnering with the AOA. So through funding, through administration, advisement, through all aspects that really build an organization, the AOA has been critical to our success.
As president of the American Osteopathic Foundation, we have the pleasure of in part funding the clinics that we're going to. DOCARE International is providing care to people who otherwise would not have the ability to get medical care. Some of these people have never seen a physician before, and so this for them is the first time to get the medical care that they need.
Well, I'm very impressed with the clinic. In fact, very surprised that it's bigger than I thought it would be, and they're seeing 35 patients a day here, and some OB-GYN care, care that this area just wouldn't have had. And the staff seem very knowledgeable and very friendly, and the students here all say that they've had a great experience. So I'm very proud of this clinic. They say it, but it truly has been a life-changing experience.
Coming from the American Osteopathic Foundation and the investment we've made with DOCARE and the efforts that they've had here in Guatemala, I think it really brings full circle what the impact that our money and investment has had and what they're doing and the committed people that are part of this organization. So to be able to go back to our board of directors and tell them about the impact we're having and the incredible job that DOCARE does on an annual basis is pretty rewarding. This is the third year of the Foundation's commitment and pledge to DOCARE, and I think one of the reasons we came down here is to see the impact we're having and to possibly commit to another pledge, which would be multi-year. By me being here and having the president of our organization, John Windsor, here, we can go back to our board and essentially with an unbiased point of view and tell them that, it's been a great investment and that we're moving in the right direction.
What I'd like to see in Guatemala is I'd like to see us establish a presence that we can treat everything, not just on a one-time basis, but if somebody needs ongoing care. What I'd like to see is us to be able to bring the equipment in that we need to be able to diagnose and to treat ongoing, not just in the larger cities, but also out in the small villages like we are today. So my goal is to do whatever we possibly can to get that to happen.
What I'd actually like to see occur is as our infrastructure grows and we get to know more and more communities and partner with them, so our continuity care advances, so that we really do improve health and well-being. So what's our first continuity clinic turns into 2 and then 3. We're in a very unique spot. We have professionals and we have students that are all part of the same organization. So to use the resources to train future resources and to have a lot of fun doing it just makes perfect sense. And that's, we're associated with multiple specialties, and so we really have access to so much, and it's amazing to be able to use.
In a world where it's easy to feel helpless in the face of violence, war, and inhumanity, there is a power within all of us to help make the world a better place. On any given day, DOCARE volunteers are going out of their way to provide quality medical care and help end the suffering of those caught in crisis, to help restore their ability to rebuild their lives and their communities. In the countries where DOCARE works, malnutrition, poverty, disease, and a lack of quality health care are daily realities. It's impossible to know what situations we will encounter or what we will see, but we know that during our time, our presence could mean a life-saving difference to someone. DOCARE doctors work to end the suffering, to cure infectious diseases, and bring the life-saving tools of modern medicine to communities that need them the most. The world is our clinic. The patients are our virtue. The rewards of that are priceless.